Awesome. My name is Garrett Oyama. I'm the host for this series, this mini podcast series. It's called Converging Careers, which is just a series about, I wanted to talk to different people from other fields and from, especially from kind of tangential fields to speech therapy to see how their insights might inform our practice as therapists. And as a musician as well, I'm definitely been super biased in picking my guests who have kind of a background in musical cognition as well as speech. So today's episode is entitled Tuning In: How Music and Attention Shape Language Therapy. And we are blessed to have Christina der Nederlanden here. I hope I said your name correctly.
Beautiful.
And she directs the LAMA, the Language, Attention, Music, and Audition Lab, studying the perceptual, cognitive, and neural processes underlying human communication, focusing on music and language. Her research explores how we attend to communicative signals like speech and song in real-world, noisy environments, and how music can support language development, particularly in individuals with dyslexia. So Christina earned her PhD in experimental psychology from UNLV in 2016 and has honed her neuroscience expertise during her postdoc at the University of Western Ontario and as a visiting scholar at the Donders Institute. Before we get started, we have a few items to alert you to. The course is 1 hour and it's offered for 0.1 ASHA CEUs. So just a quick financial disclosure, we each receive an honorarium from speechtherapypd.com, but we have no other disclosures. So without further ado, Christina, welcome to the podcast.
Thank you so much. I'm really glad to be here. I have always sort of wanted to be an SLP, even though obviously I am very much not one. So it's very much my honor to be on the show, on the podcast.
Awesome. We'll make you an honorary SLP after today. We'll knight you. So I always ask the guests a little bit about their origin story. So what got you interested in this field, specifically with regards to kind of like infant music and language?
Yeah, so I have been always very interested in music and music in the brain and music and language. From, I don't know, grade 2, I've been in choirs. From grade 4, I think, grade 5, I was in orchestras. So I played the cello. And by the way, you said something about being biased and always choosing musicians. But the problem, if you're interested at all in music cognition, every single one of us, actually a lot of even just auditory researchers, play an instrument of some sort. So the music cognition conferences are always really a fun time where everybody brings their instrument, and if they can play, an ad lib sort of, so to speak, then there's a impromptu jam session at those sorts of things. So hey, you're in good company.
I love that.
If you're looking at music cognition.
That's my type of.
Yeah, exactly. So I've always been interested in music, and I remember kind of struggling in undergrad, trying to figure out what sort of degree I wanted to choose. I knew I wanted to teach, but I didn't really know what. And I knew that I always really loved the brain. And my dad really got me onto this researcher, Oliver Sacks. I don't know if you've ever read anything by him, but
Yeah, love him.
Okay.
I'm just reading his book now, Letters, that just came out, or his posthumous volume of letters. They're amazing.
I should look at that. Yeah, and so he had just shown me a bunch of his short stories because he's a great writer, but he's a neurologist, and he was always really interested in music as well. And so a while later, I think one of his books came out called Musicophilia, and it was all about, how the brain processes music, and especially when something goes wrong, he's often looking at pathologies, so like tumor growth or after stroke or something like that, what happens. And that was just so fascinating to me that I thought, are there people that study this? I remember people around me at the time were like, I don't really think so many people study that. And I was like, but I found this book about this thing. Somebody must study it. And so long story short, I started looking for, people who I thought were great researchers. So I'd read the article, and at the end I'd be like, okay, who are they citing, or who wrote this article? And then I started applying to some of those labs. And I was lucky enough to get into a lab in Las Vegas, Nevada. Yes, they study more things than gambling in Las Vegas. And then I guess the rest is history. I started looking at music in the brain, and I had always been interested in development because that's sort of where I think, some of the biggest questions that we have about, like how are we able to, listen to music and enjoy it? Or how are we able to For instance, with language, how do we learn language? Through exposure and through experiences. And so those are the foundational questions, I think, are the developmental ones. And so that was always interesting to me. And yeah, I
Yeah,
just started from there, from a love for music to love for the brain to thinking, oh yeah, development is where all the really cool questions are.
that's so cool. I feel like a kinship there. That was like similar, very similar to my path in a way. And you mentioned a critical sort of point that it is really mysterious. There's not as much known about, let's say how we understand music and speech as, pre-symbolic infants. I talked with Bob Slevick. I don't know if you know him on this podcast just a couple of podcasts ago. And he was, talking about his view of, that basically speech and music, they exist on this continuum. It's like, organized sound. And,
Mhm.
he talked about the example of, okay, we sort of know that, Bach concerto is music, and like, the Ferris Bueller Day Off, like that teacher, Ben Stein, him giving a lecture, that's speech. But then there's this like continuum in between where you have, Bob Dylan, he was awarded the Nobel Prize for Poetry. You have, rappers, you have people doing coordinated protest. And, there isn't this like clear point at which you can say, that's music, that's not music. And, I was wondering, and I think this is really relevant to kids who, are essentially hearing organized sound, or maybe not kids but babies, right? And they have to figure out what goes where.
Mhm.
And I think that's where a lot of your research has shed a bunch of light on this topic. But I was wondering if maybe before you could share, maybe talk a little bit more about your views on, what are music and speech, and how are they maybe similar and different.
Yeah, well, I think that's like again one of the first questions that I started asking in graduate school. So I was kind of interested in like how can we leverage different acoustic features of music and then use them for language so that we could maybe benefit language. And so then I thought, okay, well, I've got to look at this huge literature. I'm sure there must be this huge literature there of like how are music and language different, or how are speech and song in particular different from one another. Because if I can figure out how they're different, then I can see like, okay, well, what does music have that speech doesn't, that we could try to like tap into? And then I realized that there really wasn't a lot on that. Bob Slavic, I remember reading some of his papers and thinking like, oh, people are asking these questions, and starting to get into it. There certainly is a history and a literature out there that compares music to language in a lot of different ways. But there wasn't anything that I felt that was really comparing like the acoustic signal of speech versus song. And so actually, can I share my screen? Am I allowed? It says I can.
Yeah,
But
sure.
um, I have to open system preferences, sorry, and say like, yes, this is okay. Sorry. I should have
No
done this
problem.
before. But what I want to show you is not be able to do it. I'll just quick try it. Select a tab to share or a window. Here we go. There we go. Can you? No, I can't. Okay.
Yeah,
Sorry
got it.
about that. Okay, well,
Um,
then I'll describe it. So, what it is it's the continuum from speech to song. And, on the speech side, it's things like lecture, like what I'm doing right now. You're not like mistaking me for singing in this moment. At least I hope not. And then you can get into maybe toward the middle, something like more like infant directed speech, right? So, you kind of just said the input that infants are getting is maybe not all that distinct in terms of infant directed speech versus infant directed song. So infant directed speech is just, this really exaggerated, hi, how are you? Like, almost sung speech. And then you can get into things that are kind of more sung. The thing I have on this continuum is Sprechstimme. This is a German word for
mm.
spoken. Actually, I forget what Stimme means. My German teacher would be sad. But basically, it's like, oh, maybe voice. So it's speech voice, but it's actually like an operatic thing. So it's also kind of infant directed, honestly, in a
Mm.
way. Then you get into rap, then you get into lullaby and all this kind of thing that kind of turns into, what Bob was talking about, just like things that we know are song, right? And then underneath that figure is a bunch of potential acoustic features that can get us from one side to the other. So rhythm is the one that I like to think about the most. When we get to song, it's really this organized rhythm that has a beat, that has a hierarchical structure, this alternation of strong and weak beats. You can tap or you can clap along to song, but you really can't clap or tap along to speech. If I asked you, Garrett, to start tapping or clapping along to what I'm saying right now, you would be like trying to anticipate something and often getting it wrong, right? But if
Although
I
they do have those videos recently of like drummers that are playing along to speech, although I'm sure they've had to like repeat and hear it
yeah,
over
yeah.
and over again. But yeah,
Probably have to loop it. Ooh, send me that. I would really like to see that. That'd be
oh,
perfect.
they're really cool. They're
It's
awesome.
not easy at the very least, right? And you
It's
have to
not
be like a
easy.
professional drummer in order to find like, okay, this is this micro timing that's happening or something like that in order to follow speech. So that rhythmic regularity is a big thing that differs between speech and song. Another big thing is pitch. And so obviously music and language, speech and song both use pitch and use it in important ways. When I'm asking a question, the inflection goes up at the end, or if I'm making a statement, it goes down. So we use pitch in speech. But the way that we use it in song is different. We move kind of in discrete sort of pitches and these kind of level changes, right? Where we're moving our voice, at least in Western music. I'm always talking from a Western perspective. I should mention that, Western tonal music. But so we kind of move in these discrete movements. That's from note to note. We're doing all this kind of thing. And when we hold out a note, it's usually not changing unless we've got a lot of vibrato on it. But the pitch is flat, flat like a
Mm.
tabletop. That's how I describe it. And then there are a bunch of other things that I think are probably less important, but are still there. There's things like tempo. So usually song is a little bit slower because we have to hold out those notes compared to speech. The durations of these intervals, it's not just regular, but in song, a short note is usually half the duration of a longer note, right? Or a quarter or some integer multiple. There are also intervals in pitch and all these sorts of structures. So all these structures that are there in music that are not necessarily there or not organized in the way that they are in music. And so there are all these differences. And one of
And
the
they
big questions that my lab is looking at is like, when do kids learn that? Because when kids are starting to show us, like, for instance, when they're singing or speaking, that they're really doing something fundamentally different with their voice. So when they sing, they're actually like moving from note to note, right? Or are they just kind of gliding like they would if they were speaking, right? When I'm speaking, the pitch of my voice is moving, but it doesn't move discretely. So when do kids start to figure that out? When we sing, we move in these discrete movements. When we speak, we can just glide around from note to note. We can say yes, right? That's fine to do. You can't really do that in Western tonal music. So one of my graduate students is looking at exactly that question with 4-year-olds and 8-year-olds. And then my other graduate student is starting to look at this question in infants. So when do infants kind of look longer when you mess up those pitch intervals in a song compared to when you do that in speech? So I guess the answer is we don't really know quite yet. But my lab is definitely looking at those things, trying to understand when is it that we kind of treat music and language or speech and song as distinct forms of human communication.
Yeah, so cool. Yeah, and one question that I had, I spoke with Diana Deutsch recently, we've talked about this on this podcast before, the speech to song illusion,
Yeah.
where, you kind of, if you hear a phrase repeated, not for every phrase, but for a lot of phrases that have some sort of pitch variation, if you
Mhm.
like impose kind of a tempo, so if you repeat the phrase and then you hear it over and over again, you start to you recognize the elements of pitch that were not there, that were there, but you were kind of passing over them because you're considering them speech. So you hear this, there's this shift from, speech to, then you
Song.
start to hear a song.
Yeah.
And one thing I was wondering is, and I don't know if, I know your lab has looked at older kids and, found that, for example, 4-year-olds are better at categorizing, or sorry, 4-year-olds who are better at categorizing speech and music, show better language skills. But do you have any idea of if those kids might, at what age might they be prone to this illusion, let's say? So, and do you think infants would also maybe be subject to that?
Mhm. Yeah, I think so. I think maybe you asked me a question before, like what is my stance on this kind of speech or this continuum from speech to song, and so I'll answer that now and then answer your question, which is
Okay,
that
yeah.
I really do think that that speech and song are not that different in infancy in terms of the way that infants are exposed to this kind of special type of speech or the special register, this infant directed register. So I think that the acoustic signal itself is like, if you were to draw like a distribution of these acoustic characteristics that I mentioned, I think that's really quite overlapping, infant directed speech and song. But there are, of course, lots of different features that could help you kind of tease those things apart. And so I really do think that kids need to learn it based on these different contexts. So the context, the visual and the audio context could be distinct enough that kids know that, okay, when my caregiver is singing to me, we're doing this thing. We're like playing, right? We're doing this kind of thing. Maybe when they're speaking to me, it's because they're, doing something like changing my diaper or doing something like that. And so they start to kind of, these contexts differ. But I'll tell you right now, I'm on maternity leave still, and I have a 6-month-old at home. And I am not really, using one context to speak or another context to sing. So even I think those audiovisual experiences that at least my baby is having are very much overlapped. And so I think that I really do think it takes time for babies to figure out what is the difference between speech and song, and like what kinds of the constellation of acoustic features and even rules that you need to have to differentiate those things. And so then your question was about the speech to song illusion, which I did. I did my master's thesis all about the speech to song illusion. So there's some of my neural
Cool.
cortex is devoted to sometimes behave so strangely stimulus.
Yep.
Uh,
Yep.
and so this stimulus is a really cool example of, these boundary cases where usually we don't confuse speech and song, but in this case, I think that this excerpt of Diana Deutsch speaking had enough of these kind of acoustic features that on this kind of speech to song continuum suggest that it could, the more you hear it repeated, the more you think, hey, actually, maybe this could be someone singing. So I think it had a couple things going for it. I think it had more flat fundamental frequency. So the pitch of Diana Deutsch's voice for each one of the words that she said kind of was stable at each word that she said. I think the rhythm was more regular. And so I think those things were happening in there. And so I think for an infant or for a child, actually in this study, we did use the speech to song illusions, but we didn't do it in this kind of way where you repeat it multiple times, because that is hard. So my first part of the answer is that I don't know that we could do this study with infants, because I don't know how they would respond to it. They would look longer maybe if they heard some sort of transformation, but they don't know the difference between speech and song. So I don't know.
Do you
I
think it
would
would?
have to test it in a different way.
Do you think that it would show some sort of like P300 or some? Would it be kind of some change in stimulus? Probably not, but
I don't know. I don't know that they would, because I personally feel they don't have these categories. So maybe you would notice some sort of change in some, I would say it's detecting some sort of acoustic feature that you change in the stimulus. So they would notice, a pitch change more if they were hearing it as song than if they were hearing it as speech or something like that. So I think you'd have to do something like that. But in this paper that you kind of mentioned, this developmental science paper, where we look at how kids differentiate speech and song, we did use the speech to song illusions. And it was really fun. I ran the study. And so sometimes 4-year-olds, we did this kind of elaborate task where they listened to a sound and we said, oh no, the person who was recording these sound files, the sound engineer didn't label any of the files. And so now they don't know if these sounds are for the play or for the musical. And we spent a lot of time talking about what plays and musicals are. And so they had to take a
pretty
physical
clever.
sound card and they had to put it into the bucket for the play or the bucket for the musical. And for, obvious, like what we called the overt spoken and overt sung, kids were pretty good at it. There are a couple where they'd get confused. But when those speech to song illusions came up, they would listen to it and then they would kind of just pause. And then like you would see him just kind of like look and be like, I don't really know. Like, I guess this could be song. Or so I feel like it was in that gray zone, that if we have that continuum, it was somewhere in the middle where kids were like, who knows? This could be song, this could be speech. And so it was really dependent on the individual kid if they would tip it into the song bucket or tip it back into the speech bucket. So
I would love to see that footage.
I
It would
don't
It kind of reminds me of a couple of points, but it reminds me of how even in speech with our phonemes, they used to think that you could take a bunch of speech and then cut it up such that each little phoneme you can take them out and then recombine them and make new words. But it turns out that that's totally not possible because of, kind of unclear phonetic boundaries between all of these, especially connected speech. But
And those subtle ways that those phonemes change depending on what other speech sounds are around them, right?
right, exactly. So context totally matters, and
Yeah.
it's kind of reminds me of that because there are these, you can what a T and a B sound like t and b, or a t and duh, I guess. But these very subtle timing cues and harmonic cues separate the sounds, and not in an exact way, because there's kind of vagueness around the borders of different sounds where you can kind of hear them differently. And even your visual cues, like the McGurk effect, right? Your brain is taking in visual information, and it's also using that
Mhm.
to help you distinguish between the two. Just I suppose it's
Yeah.
like music, but yeah.
Well, I love that. And and it actually reminds me of another researcher's work who you guys should probably check out her work sometime. Her name is Lori Holt, and she does a lot of this work of, there are so many different acoustic features that are important for differentiating, like you said, a, a duh from a tuh or something like that. And we might think, oh, voice onset time is sort of like the biggest one because that's at least what in the work that we do, that's like an easy one to manipulate. Like, okay, we make the difference between the burst and the voice onset time bigger or really close together, and we can really make you think it's a duh or a tuh. But then she was looking at a couple other, I forget, like the second formant or these other sorts of features and phonemes, and then actually making a cue that people were using reliably. Let's say people were really relying on voice onset time, and then all of a sudden making it really unreliable, and seeing how people would shift their perception of it or shift their use of different acoustic features. So to be able to figure out how to do these differentiations between. So yeah, I think about her work a lot because here this is like the same sort of categorization process, except it's on a much like gross, like a higher level, right? It's speech versus song. So what are the acoustic cues that people are weighing? And then, if I'm singing versus if somebody else is singing, does that mean that you change the kind of acoustic cues that you say, oh, this means this person is singing, right? Like Leonard Cohen. I'm in Canada right now, and so Leonard Cohen is, a famous Canadian singer, right? But is he singing? When I don't know, I wish that we had a clip or something like that. But when he kind of sings, it's kind of a gravelly voice, and it like you can kind of tell he's drawing words out. And so then maybe for that I would use, if I were trying to figure out for Leonard Cohen what song and what speech, I would focus on different acoustic features. If it was me singing versus speaking, I'd focus more on, fundamental frequency stability, the flatness of the pitch or something like that. And so I think that this question of how do you differentiate speech and song is actually part of just this much bigger question of almost like auditory scene analysis. How is it that we figure out the world around us? That
Yeah.
we use cues and we use them in this kind of context relevant way to make the best predictions based on the sounds that we're hearing so that we can respond in an appropriate manner. So the thing I always think about with this speech and song differentiation is people always ask me like, Christina, why does it actually matter if we can tell the difference between speech and song? And I say, sure, okay, that's probably true. But let's say, a kid, who's learning language, is learning words, and so they're around one and they're learning these kind of associations. What if they never figure out that like the kind of pitch variations when their caregiver is singing to them aren't meaningful, right? Because they're singing to them, those pitch variations don't matter for the semantic meaning of some particular word. And they
Yeah,
might
happens
have
in autism, right?
yeah, yeah, actually, there are some studies that look exactly at that for autism. Then they may have real trouble like assigning this particular word to this particular object, and then that object label pairing is much more effortful, or takes a lot longer than another kid that is like, okay, I know they're singing and I know those pitch variations don't matter in this word. It's actually these phonetic contrasts. I mean, of course, I'm like talking through something that they're doing implicitly. Um,
Right.
but those phonetic contrasts are the things that I need to be paying attention to. And so that's how I kind of pair those speech sounds to this. And so I do think it matters. I think that the speech and song differences are pretty big, but I think it kind of like it lends you kind of a window into this world of like how are kids figuring out these different acoustic characteristics, making categories of them, and then using those categories for their benefit, for learning, right? And so that's, I think, why I really love these sorts of questions related to like, is that speech or is that song? Because it gives you a little bit more of like, yeah, how is it that we figure this out? What acoustic features, what context, what ways do kids kind of use this information to help them to learn language and to, assign meaning to different speech sounds and yeah, become a communicative adult.
Yeah, it seems like attending to relevant features. Like I'm imagining like a visual analogy where if let's say you're like trying to figure out dogs and cats, and you really thought that color was like super important, then you'd see all these different dogs and oh, that's a dog, but that one's a different color. That's not a dog. That one has spots. That's not a dog.
Yeah.
And it's like if you held on to that for too long, you would never get to the root of dog and cat, let's say, distinction. And so and you found that these very kind of striking connections between kids that can make this distinction, and then kids that and those kids who can make that distinction have better language skills later
Mhm.
on.
Yeah, and we're not sure, it's a correlation, and so we're not sure which way the arrow goes for that. So we don't know if it's that those kids that are better at categorizing then are learning language better, and so they have a larger vocabulary, or if it's the opposite way, that those kids that have a larger vocabulary now somehow are better at kind of teasing apart the categories, right? Because obviously language is going to help you figure out, how to separate these categories more efficiently. But yeah, that's something that we're looking into in the lab about, if we could sort of like train kids to differentiate speech and song or to kind of do this more rapidly, does that help them with other language skills for either like, learn word learning or for this sort of learning these different phonetic contrasts. And so, yeah, this is something we're looking at in the lab, but we're much in the early days of those sorts of
Mm.
studies. So I really don't know yet.
Well, that would be revolutionary for speech therapists for sure.
Yeah,
Seems like
that would be
many paradigms.
a really fun way to engage kids in therapy, I'm sure.
We'll definitely stay in contact because I think that could be a fruitful way to test some of these things out with
Yeah.
speech kids. Yeah, and kind of going back to early on in infancy, you did another study that where 5-month-old babies, they noticed changes in speech sounds better than changes in music. And I'm wondering if you can maybe explain that a little bit more, like why is speech maybe foregrounded in comparison to music when kids are young?
Yeah, so for that particular study, the music was like instrumental instruments. So I forget what we used. I think I probably used the cello because I play the cello and also because like it actually has really similar characteristics to the human voice acoustically. And so in that particular study, what we're trying to look at is something that we've looked at with kids and with adults, that there's this funny thing that happens when we don't tell adults or kids and now infants too what to pay attention to, but we just ask them to notice a change. And so we for kids, what we did was we said, hey, there are two bags, party bags, and for kids everything being the same is very important. So we said there are two party bags, and you need to tell us if these two party bags have the same toys in them or different toys in them. They couldn't see what was in them, but they could hear it. And so then the character in the game shook the bags, and then they had to listen to them and say whether or not they were the same as each other or different from each other. And what we found was that anytime we had four different types of sounds that changed. There was the human voice, we had musical instruments, we had environmental sounds like trains and these sorts of things, and then we had animal voices, so like dog bark or these sorts of things. And so anytime the human voice would change, people would always notice that. So this was in part of a study called a change blindness study, or rather change deafness, because it was about auditory things. And we found that people, have anywhere, they miss like a quarter of the changes. But for speech, they miss them at like, there's like 5% of these sorts of changes that people didn't notice. So it was like, again, very, very close to, 100% accuracy for noticing those. And so then we kind of asked, well, is this something that, we learn through experience, that, these kind of speech sounds are really important? Or is this something that is present from very early on? And so that's why we did the 5-month-olds. 5-month-olds, of course, have a lot of experience. Again, I have a 6-month-old, and I know it's felt like a lot longer than 5 months or 6 months having this little dude around. And so he's gotten a ton of exposure to the human voice and all these sorts of things. But even still, these 4 or 5-month-old babies, whenever the human voice changed compared to, again, like a cello, or I think that I forget what other sounds we did in there, but maybe animal vocalizations or some natural water sounds that have some nice, soothing characteristics to it. They still were noticing when the human voice changed the most compared to the other types of changes. And when that really tells us is that whatever is going on, if this is just that this stimulus is social and so we know that we need to attend to it, or if the acoustic features of the human voice are really unique and kind of like vocal utterances are kind of made in such a way that they're really attention grabbing for the human brain, whatever is going on, it's happening already at 4 or 5 months of age. And so that really suggests that we have these attentional biases towards speech that are really, really important for these sorts of everyday listening situations. You think even of the classroom, if you don't have that bias towards speech, then it's going to be really hard to pay attention to that speech when your teacher is telling you something important. In
Yeah.
infancy, if you don't have that bias towards speech, then it's going to be really hard to, again, get that really, really heavy dose of speech sounds from your native language to learn all these different phonetic categories. And then again, to build along with that, to learn words and to assign those words to objects, and to do that, to do these different, really important mappings to learn your language. And so, yeah, we've been looking at these sorts of questions now in the lab. One of my other graduate students just finished a study looking at whether or not your language experience also affects it, to see if it is experience dependent, and it absolutely is. So if you speak Mandarin, when you have Mandarin and English changes in the scene, then you are better at detecting those Mandarin changes than a monolingual English speaker. So we think there's some experience stuff going on there, but I really have this kind of feeling that it's about kind of the social status of the stimulus. So
Mm.
yeah, yeah.
That would be really interesting to see in autism if that changes. If that
Yeah, so we have a study already out with kids with autism. One of my colleagues, Brianne Yerkes, who graduated from UNLV as well, she did a study with older kids with autism, probably like autism level 1, which some people call like high functioning autism. And so with those kids, they noticed speech changes at a similar like difference between. So they attended more to. They had a bias toward attending to speech compared to other sounds,
Mm.
but they were reduced overall in their ability to detect the changes. But still, so they showed some sort of bias. But yes, I have those questions for sure in maybe autism level 2 or these other kind of levels of autism that are maybe a little bit more pervasive, or in different settings outside of the lab, right? This is an in-lab setting where we're like detect the changes and then we're do these things. But what about in these kind of more naturalistic settings where it's more possible to ignore certain sounds if you don't prefer listening to them as much? So
Yeah, that's so interesting. Yeah, this whole idea of attention and needing to because I guess in any scene, anywhere you are, the amount of things that you could pay attention to is like combinatorially explosive. It's like too many things to choose
yeah.
from, and like how do how do we choose what's important?
Mm,
I mean, imagine that you come into the world with definitely some biases, innate biases
yeah.
there. But also in the womb, like your auditory system is developing,
Mhm.
and like right when you're born, like some people say that the mother's voice is like a credible signal. It helps. It's a biological signal which the infant is using to help decide who is safe and who isn't, and yeah, and it's amazing to me that you can hear, or infants are reported to hear the emotion that the auditory stimulus is so connected to emotional responses. Like a
Mm,
soft voice can elicit, comfort, whereas, if you're an
mhm,
angry voice, it's like, you can elicit fear.
mhm.
And those things are so interesting.
Yeah.
Why would it be that way? But
Yeah, the prosody of so Bob Slevik kind of thinks that, that maybe speech comes from song. He has a paper that kind of looks at this a little bit. And so a lot of those prosodic features of speech, maybe could be from its origins of coming from music or song first. And so when you're angry, you kind of use these sorts of sounds that are the same sorts of kind of acoustic features that you might use for singing. And so there are lots of studies that at least kind of think that at least for emotion there's kind of like a common code for music and language or for speech and song. And so that a lot of the ways that we try to convey emotion in music are the same as the ways that we try to convey emotion in speech.
yeah,
So
so
yeah,
cool.
so there's a lot of overlap there, but you get a lot of prosodic information, so like that kind of music of speech in the womb. And so there's a lot of bone conduction happening for babies hearing in the womb. And so they're hearing quite a bit. They're hearing a lot of the rhythms of speech. So there's a lot of really cool older studies that show that when babies are born, as soon as they're born, they can actually differentiate between the rhythm of the speech that their mother was speaking compared to a different language that has kind of a different rhythmic characteristic. So they're hearing all of these sorts of things in utero and learning a lot. And that's why you can't kind of look at a lot of these like a neonate study and say like, look, this must be innate because on day one we put some headphones on this baby, they were born,
Right.
and now we can say, okay, this is the first sound that they're hearing outside of the womb, but like, okay, but they heard so much sound from 20 weeks gestation, their auditory system is pretty well in place. And so that's a whole 20 weeks of experience of exposure and a heavy dose from their caregiver, from the mother. So there's just a lot of cool auditory stuff going on there that I think is really interesting.
I love that there's still so much to learn about it too. One
Yes.
thing that I was, been trying to make this point to therapists too, speech therapists, is, I think a lot are scared to use music as a tool because, oh, that's for music therapists, and even a lot of music therapists are like, you can't use my tool, you're not a trained music therapist. But like these boundaries, like, do they, yeah, I mean, they, it's unclear what came first, who, so I really think that music in so many ways is is a helpful tool for learning speech, being that it's like you're mentioning before, the pitch changes are, you hold the pitch for longer. The changes that you might hear are, there's this regular pattern, a rhythmic pattern that you can grab onto, and, might act as even a better imitative model for learning words, in lullaby. Maybe can you speak a little bit to maybe a bit of the overlap and why you think that music might be helpful for
Yeah.
speech?
So I have a paper out that looks at kind of like the neural processing of speech and song in adults. And then I've have all the data, but I keep on going on maternity leaves, and it makes it tough to get this particular paper out. But I have a paper on kids with dyslexia that looks at how kids with dyslexia are processing music and language. And really, it's the same sentence spoken or sung. And we really looked at how does the brain process or track kind of the rhythms of this utterance, this spoken or sung utterance. And so my prediction going in was that hey, music has this really nice rigid, what I call a scaffold, basically. So like you've got, like you said, you've got like these moments in time that are very clearly indicated in music that says like this is where the beat's going to happen. So probably there's going to be a word there too if we're singing like Mary Had a Little Lamb or something, right? It's Mary had a little lamb, and you've got this strong beat and a weak beat, and on that strong beat there's probably going to be something there, because especially in kids music we don't do a lot of syncopation. That's moving things just off of the strong beat, right? And so what we looked at was we took a sentence and we spoke it, or I had somebody speak it, and then I songified it, kind of like the things well, I mean, I did it in a much nicer way, but you can have those like Songify apps that do it
Yeah.
for you, which are very fun. If you ever want to go down a rabbit hole, it is fun to go
Yeah,
down.
they're crazy. They're getting way better too.
And so we basically did that so that the sung version had the same contour as like the same kind of ups and downs of the melody of the speech, except that it had a nice rhythm to it. So it actually had this alternation of strong and weak beats, which is this kind of thing we call meter or a beat in music. And what we found was that in the adults, we found that especially in the tough listening condition, their brains were better at tracking the speech sounds, the syllable information when we sung it compared to when we spoke it. We did another study where we had people do it like an active listening condition. That first one was a passive one, so they didn't actually have to listen to it. They were watching Wall-E. This is just their brain kind of processing the sounds. In this other study that I did in the Netherlands, we actually had them listen to them and we had them kind of do a task with it too. And then we found that same effect, that people were better at tracking syllables when they were sung compared to spoken in easy listening conditions and in the hard listening conditions. And now we have this study that I have it all written up. I just am trying to do the final touches. Like I said, I'm on mat leave, so don't give me a hard time for not getting it out yet. But
How
this
could
is,
you?
I know it's terrible. These were kids who are 8 to 10 who have dyslexia or some sort of a specific speech language impairment. And what we found was that for those kids, they looked just like their typically developing peers when they were processing song. So like their brains were processing syllables in the same way when the words were sung. But when they were spoken, the typically developing kids were processing or tracking the syllable information, but the dyslexic kids were not. They were actually processing things or tracking things at a much faster rate than they ought to have been. And so we're still trying to figure out exactly what like why the faster rate. But I think the take home from this study is that kids are when they're dyslexic kids look just like their peers when they're processing the sung version of these sentences. And so that gave us this kind of first kind of inkling of like, hey, when we sing things in these therapeutic contexts or in other contexts, it may actually kind of make it easier for the brain to track and predict when that next syllable is going to come. And so that makes it almost kind of levels the playing field for these
Mm.
kids with dyslexia processing language compared to typically developing peers. And so this was some of this kind of
Wow.
first evidence for some sort of underlying process of like, well, what is it that kind of helps kids process language better when it's sung compared to spoken? And so maybe it's really about this rhythmic structure and this like again what I said, kind of providing a scaffold to help kids predict. So that's really what a lot of the projects in my lab are really trying to dig into right now is what is it about music and especially rhythmic regularity that can benefit language processing.
Well, it reminds me of when Dr. Gran was speaking at the symposium. She showed a bunch of really cool examples of like Parkinson's patients that were listening to music that they totally couldn't walk, and then having a music a rhythm, suddenly their steps are they almost look like normal. Um, and so it was really, really incredible. I wonder if that has something to do with that again, that
Yeah.
regularity and the ability to predict. And
Yep.
yeah, because that was interesting to me that the kids with dyslexia would be showing like faster processing,
Mhm.
but it kind of, yeah, I guess it reminds me of, yeah, that, and of maybe fluency too, where kids that stutter, they find that music scaffold, like you're saying, helpful, like training wheels, right, on
Yeah,
a bike.
exactly like that. Yeah, so I did this work with Dr. Gran in her lab and kind of thinking of these sorts of ideas. She's done so much amazing work with beat processing and how that kind of rhythmic structure is really beneficial in a lot of different ways and in terms of looking at Parkinson's and kind of again she's really looking at these kind of structures in the brain that are involved in processing dopamine and this regular processing of a beat. And so this is looking at it from a bit of a different angle because I'm not looking at it in exactly the kind of dopamine, this dopaminergic system, all these sorts of things. But I mean, it must be involved, right? Because when we listen to something that has a beat compared to something that doesn't, then, these kind of motor areas and these areas involved in kind of reward system are all active. And so, yeah, I think there's a lot of different relationships here, and there's a lot of questions about exactly how all these pieces fit together, and when they work, or do they not work for everyone? Does it, the same sort of questions with dyslexia. Does a music scaffold really work for some people but not at all for other people, and why is that? So looking at these sorts of things that I'm sure that you clinicians do all the time, like this really individualized person, looking at exactly what this person can do or enjoys doing, is a really big piece of the puzzle. And so, in psychology, we're looking at like a population level, but I think that those individual approaches are really important, and we're trying to kind of look at more and more of that as we do more of this work.
Oh, cool. We'll be looking forward to hearing more of your research and hopefully implementing it, and getting some training paradigms would be helpful
Yeah.
for
Yes.
all of us. Yeah, I'm wondering, if you have any, things that other things that you feel are like unanswered questions, either about language and music or development that
Yeah.
you'd like to see answered in the near future.
Oh, there's so many things, but then I'm always like, I love, my problem is I love starting new studies, but actually writing them up is not nearly as fun as like designing new studies and doing all these sorts of things. So, I mean, there are a million questions that I'd love to do. I think that the questions that I'm always interested in are looking at rhythm and learning, and early development. And so we have a bunch of studies going on in the lab right now looking at like, for learning German, for instance, are we better at learning that when we put the word that you need to learn on the beat versus off the beat? Or does it actually help to be off the beat because that's more salient and syncopated? So asking these sort of like really low level perceptual questions, I think I find really interesting, and they take time because you have to be really exacting with like the acoustic materials that you develop. But then that always makes me want to say, like, but clinicians are not going to be like getting the, like working really hard to make sure that you're doing it on the beat versus off the beat, or do this sort of thing. And maybe some musicians like yourself might be interested in that. But so then we're also doing these same sorts of questions, but outside of the lab. So we've gotten a couple of mobile EEG headsets, and we're going to be just teaching German in a classroom. We're going to do it with adults first, and then just kind of look at, okay, when we do it, in this certain way with different rhythmic characteristics happening, do people learn well? When we take those rhythmic characteristics out, do people still learn? But one thing that I really wanted to chat about before we kind of end is that I want to be careful and say that I don't think that music is like a cure all. When I talk about this all the time, like I'm always like, oh, this could be really exciting. Music could help in this sort of way. But I really want to channel a researcher that kind of articulated this really well. His name is David Huron. And he kind of said one thing that we need to be careful about is we have to think about like, okay, we don't play music or do music because of what it does for other skills, like skills in other domains, like math or language or these sorts of things. But what we do it for its own intrinsic value. And so music itself is worthwhile. And music itself is really enjoyable. And I think that's the biggest and best part about music, is that maybe even all this stuff I'm talking about with rhythmic regularity, which I think really is something important, but let's say that doesn't pan out when I do, these kind of more in the field sorts of experiments. Maybe it's just that music is fun and people are, more relaxed and more, they have higher states of arousal and they're kind of more excited, right? When they're learning in that context. And then in that context, you're going to be set up to learn better. And so there is something more about just music being fun and enjoyable, right? When you go maybe to like if you're doing speech therapy and you go in and you feel kind of bad about either not being able to pronounce something or something like that, and you're going in there and you're like, oh, they're just going to kind of show me that I can't pronounce this or something like that. But then if you kind of make it fun and you're like, okay, we're just going to sing or march around or do this sort of thing, then, it's like all these kind of like worries or assumptions kind of maybe go out the door, and you all of a sudden are like, hey, we're just having a good time, and it happens to be that you're learning as well, and that's great. So that I do want to get that point across too, that I'm trying to really, as a researcher, go into music and figure out what are the acoustic features or these characteristics of these really kind of minutia, like what could be benefiting learning in all these different domains or attention in these different domains. But I
Right.
think there is something so important about just like we do something that we really enjoy, and that is wonderful in and of itself. And that enjoyment in and of itself could be benefiting processing in a lot of different ways. So,
Oh, totally. And even just separate from benefiting, that's such a beautiful point. And I'm glad that you didn't, that most of the other people I've talked to haven't stuck on this point that, music is inherently meaningful. And it's a
yes,
weird, mysterious, beautiful thing that people just like, they just have this immediate reaction to it. And it's like kind of like, science is so wonderful for so many things, and it does tell us so much. But uh, sometimes I make the point that, like, okay, if I'm on the phone with my wife or something, like if you analyze the frequency, all the sound waves in that phone call, you'll never get to the meaning of that conversation. So like you're kind of analyzing things on a different level, and we tend to like overlook this level of living a good meaningful life. And like when you bring kids into speech therapy, especially, it's like you want them to be happy, and you don't want to be focused too much on these like really, really
things they
small
can't do.
details.
Yeah, yeah, yeah.
Exactly, at the expense of, because I can remember so many times where I went into just terrible lessons for certain things, and, they
Mhm.
were totally not fun and they were demotivating, and you don't wanna attach that to, you know, to speech therapy and learning to talk and
For sure.
communicating with others.
For sure, and I love this. I love this kind of thought question that you've kind of posed here about, like, you talk on the phone and if I analyze all the different the acoustic features, I couldn't tell what you're talking about. But now I actually wanna know, like, could I actually? Like, if I analyze the contours, I could
I'll
figure out
I'll
the emotions at least or something? I mean, and then
that would be really cool.
now I wanna study that. So maybe
I
but
love
you're
that.
right, there's always something, that, a real communication is so rich and has so many different kinds of avenues for communicating things, acoustic features, but then there's also, like, these social kind of dynamics. There's so many other different kind of prosodic or these hidden kind of sarcastic things that happen in communication, and yeah, there's just so much going on and so much wonderful and
Yeah.
beautiful about communication that's why I've dedicated a lot of my time to figuring out, like how do we communicate through speech and song and what's the difference between those and yeah, looking at all these sorts of questions. So,
So cool. Well, thank you so much. It's wonderful to talk to you, and you're definitely an inspiration. And just for everyone out there, if you have any questions, we have a couple minutes. We can try and get to them. But
yeah,
yeah, just for while we're waiting, where can people find you, and if they want to learn more about
sure.
your work?
So I am a professor at the University of Toronto, Mississauga. So I'm here in just outside of Toronto. There are 3 campuses, and I'm what direction is that? Westmost campus in Ontario. So you can find me there. I also have a website that you can find me at. Is it UTM LAMA Lab? I should know this.
Let's see, LAMA Lab.
.com. Yeah, utmlamalab.com. And then there you can find us on different socials. My students have been doing the best stuff on Instagram these days. I have nothing to do with it. Well, I have a lot to do with it, but they are just doing really fun stuff
So,
on Instagram. So give us a follow over there if you want to hear about like the latest studies that we're doing. Oh, thank you. But yeah, so you can find me there, and then all my contact information is on the website there too. So feel free to reach out. I'm always happy to chat with SLPs because I think they're doing some really awesome work that definitely dovetails with a lot of the questions that we ask in the lab. Um,
cool.
I see a
And we
couple
gotta,
questions in here. There was
yeah.
80 that I wanted to answer in the moment about ADHD too, but I
Oh yeah.
got
We
distracted.
have a couple minutes. Go ahead if you.
Yeah, so she was asking if attention to speech in complex scene, like when there are lots of other sounds going on, if that might be impaired in kids with ADHD. We haven't looked at that yet, but man, Katie, you're speaking my language because that's exactly the type of study I'd love to do next. I think my guess would be, if I'm allowed to guess, is that kids with ADHD would have the same bias towards speech in the context that we're looking at it in. But I also think that if we did some sort of task where the other sounds in the scene were either things that they really like they really liked to listen to or really preferred to listen to, because in ADHD there's this thing kind of called hyperfocus. So it's like preferred sounds or activities or something like that can be really distracting. And so I would love to do a study where we kind of look at those sorts of things and see if in that context, when there's something that they really like, they really have a hard time inhibiting. This is this kind of executive function skill of saying, no, I'm not going to listen to something. I'm going to focus on the thing that I need to be listening to. In this case, maybe speech, maybe the teacher in the classroom. So I would love to look at some of those sorts of questions. That's a really great one.
Cool. Thanks, Katie. Yeah, and
Do
you
you-
bet it. Yeah, I was saying that you'd love to use music as a tool to work on pragmatic skills, listening to instrumental songs and interpreting the tone. That's so interesting, huh?
Oh,
Like,
yeah, I've actually this sounds like a really, really cool skill. My kid right now, I have a 5-year-old too, and he if I play music and it's kind of like slow or something like that, he's like, "Mom, this music is too sad." So I think kids are kind of getting into like, okay, these different emotions that music is conveying. And so I think it would be a really cool way to look at some of these pragmatic skills and training them up. Okay, like what do you think the artist was trying to convey here? I think the tricky thing is that a lot of pop music has these kind of like what I would like think of as like the Beach Boys kind of stuff, where like the music sounds happy, but if you listen to the words, it's very much not happy. And so you'd have to
yeah,
be careful about picking those out. But I think that actually could be a cool learning tool, right? Like this sounds happy, but we'll pay more attention to the words and find that actually these things are in juxtaposition, direct like opposition of one another. So I think it could be a really cool way to look at those sorts of things.
totally. Yeah, there's so many times where it's like you know, the emotions that we see normally, like I'm trying to teach happy and sad or something to a kid, and it's like those you'd never find those just in isolation. It's like always there's like some veiled emotion, or like maybe it's
Yeah,
a like tinged with sarcasm, or like some other thing. So
yeah,
yeah, a lot of
yeah.
music is like that too, where you have maybe like you have, even if you add in the major seven or something to a happy song, you add in this element of like
Mhm.
bittersweetness,
What's
or
going on here? Yeah,
yeah,
there's something a little bit different than just pure happiness. Yeah, that's where I think that if you look at, like, children's songs, like, those are sometimes more just pure in terms of, what's going on. Lyrics match the
yeah.
tonal kind of quality that they're going for in terms of emotions, so could look at that.
Absolutely. Kid songs. I know a lot of them now from speech therapy.
Amazing.
Thank you so much again. This was so fun. Um, thank you, everyone. Thank you again, and look forward to seeing you again on another course. Thank you, Christina. Bye bye.
Thank you.